we were talking about the additional branches of Ayurveda. Now to continue with, there's another branch called Saundarya Sadhana. This branch has come up in Ayurveda to establish a safe method for cosmetics. This includes the beauty of the hair, beauty treatment for hair, beauty treatment for eyes, skin, nails and body posture and general appearance. So these includes treatments like Shirolepa, Mukhalepa, Akshitarpana, Abhyanga, Udvartana and such other treatments, where mainly the beauty is focused on. So these are the additional branches to meet the modern needs of people. Now coming to the treatment. How a disease is diagnosed and what all is covered in the treatment. So Ayurveda deals in detail from the starting defining a disease till treating the disease. So it includes the steps like a definition, giving a definition to a disease, then etiology, which is called Nidana, where the cause of the disease is dealt in detail, because it is said that till the root cause is not treated, the disease cannot be treated according to Ayurveda. Then after Nidana, after finding out the cause, then we go to the prodromal symptoms, that is Purva Rupa. This is the starting stage of every disease. At this stage, it is said that if the disease is controlled or stopped, the progression of the disease is stopped, it can be controlled very well and the further complications can be avoided. If at all the disease crosses the prodromal symptoms, that is Purva Rupa, and reaches the Rupa stage, that is the Lakshanas or the clinical symptoms, here the emergency attention is needed. The body functioning is set to imbalance stage. This is the stage where the medications are required, either in the form of pacifying or in the form of purifying. Then after this is the Upashaya stage. Upashaya is the pathophysiology. The next is the Upashaya, which is pathophysiology, where investigations are included. Here the investigations are done to confirm the disease, the stage of the disease, and to adopt a proper line of treatment. The next stage is Samprapti. Samprapti is the prognosis of the disease, that is how the disease started and how it has progressed and at what stage it is now. The next comes the Upadrava stage. This is the stage of complications, where if the disease is not treated in the stage of Samprapti, it reaches Upadrava, leading to complications. So here the more serious type of treatments has to be undertaken. The next thing to be dealt is the Chikitsa Sutra. Chikitsa Sutra is the principles of treatment. Depending on the Samprapti and Upadrava, a treatment is planned. The planning of treatment is called as Chikitsa Sutra. Then comes the Chikitsa. Chikitsa is of two types, Shamana and Shodhana. The Shamana and Shodhana Chikitsa can be best explained with an example. There is a pit and there is some water in it. If the water is too less, just by the heat of the sun or the wind, it can be dried or evaporated, leaving the pit again back into its normal condition, dried. If the water is slightly large in quantity, then some other measures has to be undertaken, like for example, sprinkling of the ash or just wiping it off. So these are the extra methods to be undertaken. This is what Shamana does, that is the use of medications to bring back the imbalanced doshas. If the pit is completely filled with water, it can neither be dried with the wind nor evaporated with the heat of the sun, neither it can be wiped or tackled with the sprinkling of ash. So only way left is just break the border and let the water flow off out of the pit. This is what the Shodhana does. When doshas exceed their normal limit, where they cannot be managed with Shamana treatments, where they cannot be managed with medications, purification becomes necessary. That is, expelling out of these doshas out of the body, either through Vamana or Virechana or some other procedures coming under the Shodhana treatment. The first method, what the heat of the sun and the wind did, this can be done with the help of Ahara and Vihara. That is, when the disease is just in the beginning stage and doshas are slightly abnormal, it can be easily dealt with the prescribed diet and lifestyle. This is how Chikitsa for each and every disease is categorized in Ayurveda. So see you tomorrow only on Arogya with few more interesting topics.